different structures right here. They are the discs. So the discs are nothing but soft gelatinous structures that give a cushioning effect to the spine. So if there were no discs, you can see that these bones would, hit against each other. They would rub against each other, and which is not a good thing, right? And also the spine would not be flexible if we didn't have these discs. So these yellow structures here, these are the nerve roots which branch out from the spinal cord. So yeah, so inside the vertebral column lies the spinal cord. It's not visible here, so it's inside the vertebral column, and from the spinal cord these nerve roots branch out. So the nerves up here, they supply they control the sensation and the movement of the hands, and the nerves down here, they control the movement and sensation of the legs, and also the bladder bowel control. Bladder bowel control means those nerves that control the urination and the defecation. So what are the causes of low back pain? It has a wide range of potential causes, and the most common causes include muscle sprain, muscle spasm, arthritis, disc issues, etc. So the usual history is a patient coming to me and telling me that they started having back pain after they lifted a heavy weight, or they went to the gym and lifted a heavy weight, or they did something that involved bending over for a long time. So this is the usual history. So what happens when you lift a weight? So there are some muscles on either sides of the vertebral column. It's called the paraspinal muscles. So when you lift a weight even as low as 5 kg, it can hurt the paraspinal muscles, or it can cause a strain on the paraspinal muscles, and also it can cause a strain on the discs. So these discs can either tear, or sometimes the tear is big enough that the pulp-like material can come outside, and this causes pain. So the pain can be very severe in the initial few days, and that might need painkillers, and with time, within like a span of 2 to 3 months, the pain gets better with exercises and physiotherapy. So like I said before, these are the nerve rootlets which are coming in between the discs. So the lower nerve roots, they supply the legs. That means it controls the sensation and the movement of the legs. So sometimes what happens is the disc, when it comes out, it can hit one of these nerves. So when it hits one of these nerves, the patient can have intense pain and numbness radiating down the leg. It's called a radicular pain. So the patient may have pain and numbness in the legs, but the nerve pinches up here in the lower back. Now, sometimes these discs bulge can even hit on the nerves which are supplying the bowel and the bladder that controls the urination and the defecation. So and the patients can even lose control of those urination or defecation, and this is a surgical emergency.